Hey guys, this is your health information management professional here, and today what we are going to do is learn how to properly complete a HIPAA form, or in best terms, an authorization for release of health information pursuant to HIPAA. This form is a form that individuals seeking to obtain a copy of their medical records would complete. So, whenever you want to receive a copy of your medical records, or you want to send someone a copy of your medical records, for example, you are visiting a new doctor and you want this doctor to see your medical records, review them for a second opinion, or you are just planning on becoming a patient there, you may want to complete this HIPAA form and submit it to the facility who currently holds your health information, and they'll take it from there. So, now that you know the purpose of this form, let's walk you through the required elements. And to keep this video brief, I want to just walk you through the required information from this authorization form. So basically, everything that is encased, so beginning with your name, date of birth, patient's address, section 7, 8, 9, 10, 11, 12, 13. And these are, of course, extras right here, but mandatory, okay, within reason, and we'll discuss that further in a little bit. All these things that I just marked are required elements in order for us to properly release a copy of your health information if you were using this form. So this is the standard form that you can go to Google and you'll easily locate it. With HIPAA forms, it doesn't necessarily matter which version you are using, as long as the facility who is to release your health information has the actual elements that are required in order to successfully release your health information. Okay? So, in completing this form, we are going to begin with first name, and that is patient name. Let's just say Jane Doe. Okay. Date of birth, we can say Jane Doe's birthday is today, which is 2/21/23. The social security number. Guys, I know that this is here on this form and it is saying you should provide it, but please keep your social security number safe from everyone. Healthcare facilities aren't necessarily required to have this in order to provide care. So if you don't wish to provide it, do not provide your social security number. It is not a required element in order for your health information to be released. So, moving on to patient address. In this field, make sure you provide a full, complete address. Okay, so you want to have full address with a street name, a town, a state, and a zip code. Provide your complete address because it does help further identify you as a patient. If your address has changed, then that's a different story, but this is a nice aspect to have when someone is completing a release of health information. Okay, moving on to section 7, name and address of health provider or entity to release this information. This question is particularly related to the provider. So this refers to the provider or entity or healthcare professional who will be releasing your information. So for example, You go to your cardiologist and you are switching cardiologist, or you just want to consult from somebody else, so you want your cardiologist to send your EKG and his final history and physical, say, to your primary care physician. Doesn't matter. You are going to put in your cardiologist's name and his address right on section 7. Okay? He is the one releasing a copy of your medical records, and you have to remember the records belong to the cardiologist. The information is about you, but the cardiologist owns the records. They are his business records, okay? So that's one. In section 8, name and address of person or category of person to whom this information will be sent. This is where you can either have the record sent directly to yourself, to your aunt, to your milkman, to your mailman, to your doctor, your attorney, whoever you choose to have a copy of your medical record. You can provide their full name and address right here. This information, guys, on section 8 of the HIPAA form is very important, yet sometimes overlooked by individuals. If you are completing a HIPAA form, please do not rush through it. Make sure that you validate the information that you are putting in. So for example, if you don't know the full address for the provider or attorney to whom you are releasing the information to, please save that form for later. Go home, look it up, contact them, and then put that information in. Because once you provide that address, there is no going back. If everything else checks out on this form, your health information management professional will complete the release and the records will be mailed out to whoever you put on that field. So please be mindful of that, okay? That goes for section 8. Section 9A, specific information to be released. Guys, this section right here, it can be a very frustrating section in some instances because some individuals don't even know where to begin. And this is where I recommend or advise against simply checking off medical record from, unless you are going to provide a date from and a date to. Please do not select medical record from. And this is this area right here, okay? Also, if you don't know which entire medical record you are referring to, please do not select entire. When someone says entire medical record, that could mean all the records found in a certain facility about you. So say, for example, you are 90 years old. You were born at ABC Hospital. ABC Hospital would have a copy of your birth records from 90 years ago if they chose to keep it. Some facilities keep records way further than the limitations set by HIPAA or the local state rules. So if you don't know how far back your facility currently holds records, it would be wise to simply provide an event or type of surgery or a type of record you are looking for. So for example, let's say you had 3 surgeries in the year 2021. You had an appendectomy, you had a hernia repair, and say you had a stent put in. Why can't we just use the other? Okay, we could use the other portion and just say hernia records. Sorry, that's hernia records from 2021. And that is simple. What we would do as health information management professionals is go through your charts for 2021, and the hernia records that are found are the ones that we would give you. Yes, it does make our lives a little bit more difficult because then we have to search specifically which hernia records we should give you. So if you had 2 instances of a visit related to a hernia, that may amount to a lot of records. So if you just want, say, the operative report, just say operative report for my hernia repair in 2021. And that narrows it down even further. You don't want to give somebody more access to your information that they should have or need to have, if that makes sense. Okay. This section right here is very important. So if I may bring your attention to section 1 right here, and you pause this video for a second, please get yourself acquainted with this. We'll bring you down to the section in 9A regarding alcohol drug treatment, mental health information, HIV related information. You would initial these spots on the form if they are applicable. So if you know that you don't have any of those issues, you don't need to initial, as of course no information found, no information will be released. So no harm, no foul. Okay, so you could leave that blank if that does not apply. This section right here, where it says authorization to discuss health information, this is exactly that. You are authorizing somebody to be able to contact the facility you are requesting records from and discuss that information over the phone with a provider. I have to tell you though that even if you do complete that, some providers may decide they wouldn't be discussing that without the actual patient in-house. So this is something that may require a little further attention, but you don't need to complete this section if you are not looking to have someone speak, to the facility regarding your information. Section 10, however, is a requirement. You do need to complete that form. If you opt to utilize this form and the records are not going to you, you do need to have these items completed. Okay? So if you are requesting the records just because this is at your request, this is simple. Simply select at your request. If you are requesting them for continued care or you are suing someone, you could say so. On the other, you can select other and then provide that information there. So you could just do this and say litigation. Okay. On section 11, date or event on which this authorization will expire. And this form, this section of the form means exactly that. So to make it simple, when you go to the food store and you buy a gallon of milk, for example, that gallon of milk comes with an expiration date of, say, for example, 2 weeks. After the 2 weeks have passed, you wouldn't dare drink that milk. It's done. You should just throw it away. It's spoiled. There's nothing you could do. Well, I'm hoping you don't drink it after it has gone bad. That's the whole purpose of the expiration date. On the HIPAA form, it's somewhat of a similar scenario, except that we won't throw it away. This gets filed permanently in your medical record until we decide to get rid of it, of course. So I want to keep this in simple terms. So on section 11, you want to give us a date. This date is usually in the future. Some people opt to do 6 months, a month, or 2 years. You could do as many years as you want, but you have to just understand that this will apply to this section that you have chose to release. So for example, this would right here, if I say this will expire, 3/21/2023. After 3/21/2023, I will no longer be able to release these records. So if you completed this form ahead of time and did not submit it to an HIM department, and it arrives to us, we will return it back to you saying it is expired, and you will have to update section 11. Does that make sense? Well, I'm hoping it does make sense. You could tell me in the comments if something is not clear enough or you would like more information, and I will come back and provide you the answer, even if it's in a short video. Okay? Moving on to section 12. Section 12 is exactly that. If it's not the patient signing the form. So for example, there are usually a husband and wife, or a friend and friend, or significant other and other, who are helping each other out in completing the form. And most people believe that just completing this on somebody's behalf is enough, as long as they provide the patient's information. Well, not so fast there. We do use signatures to validate patient's information. So you want to make sure that if you are not the patient signing the form, you do have legal supporting documents that appoint you as a personal representative for this patient. Okay? So simply having the title of friend, significant other, wife, husband, doesn't matter. Only the patient or the legal representative has the right to release or receive a copy of the patient's medical record. Patients have a right that is theirs to keep, and only the patient can release a copy of their medical records. So it is completely fine to have your significant other complete the form for you. When it comes down to the signature portion, the patient should sign and should be made aware of what the purpose of the form is and what the intentions are. That would be the moral thing to do anyways. Okay? So there you go. Moving to section 13, authority to sign on behalf of the patient. We just discussed that. If it's not the patient, then you need to say how you can sign on behalf of the patient. Simply saying wife does not grant you the right. Okay? Now, moving on to the signature portion. Again, signature of patient or representative authorized by law. And getting a little excited when I discuss this portion, because you have no idea how many people believe that simply being the wife or the husband or the daughter or the granddaughter who takes care of their elderly is, oh, that's enough. You know, I'm signing because I'm the one taking care of them. Or a most common one is, I'm the patient's healthcare proxy. Well, depending on the healthcare proxy you have, there will be different rights given to you. This is the date of signature. So we're going to keep this to 21/23, because it's today when we are doing this. And there you want to just sign. And there you go. So this is how you complete a HIPAA form. And if you do have any other questions or concerns, please reach out, leave it in the comment section, let me know. And, I'll do everything I can to try and respond to you.